Healthcare professionals on the front lines of this pandemic are working in direct contact with COVID-19 patients, so they risk not only exposing themselves, but also their families.
That was a concern for many nurses about having a place to stay so that they would not bring home this virus to either their elderly parents that live with them, their loved ones, their immunocompromised children, and also if we would become infected, would we have a place to stay where we could isolate by ourselves so that we would not have to isolate in the home.
The state of California launched in April the Healthcare Workers Lodging Program, which provides up to 100% reimbursements for healthcare workers' accommodation costs in hotels.
Will provide 100% reimbursements so that they're allowed to stay closer to their patients and provide them the opportunity not to worry about being out of pocket or worry about exposing their families or, God forbid, worried about another night sleeping in their car, so they can stay closer to the needs in their communities.
The state has set up a website for its health workers to claim hotel vouchers. Many local hotels and larger chains, including Hilton and Marriott, have also joined the program. And United Airlines is offering free flights for health workers who need to travel. Not infecting their families may be one thing less to worry about for California's healthcare workers, but many continue to demand more protections as the number of infections among their colleagues continues to rise. Many hospitals are hesitant to report these numbers. At UCLA alone, more than 175 have been reported by the Los Angeles Times. And many nurses complain about the lack of testing among medical staff.
The answer we get is if you don't have symptoms, you don't need to be tested, and we don't have enough test kits to test everyone. And also another concern is that when you are tested positive, you'll be put on quarantine for 14 days. And if your symptom improves, then you can go back to work, which is also a concern of ours, that we believe people should be tested negative before they return to work, especially healthcare workers.
With that uncertainty, more healthcare workers are likely to stay in hotels than risk of exposing their families. It is Tianshan, CGTN, Los Angeles.